In today's environment, healthcare environment, it's oftentimes difficult for people low income to obtain healthcare.
The Clearwater Free Clinic connects the useful pieces in the puzzle of healthcare, providing critical care to uninsured patients, a service benefiting the entire community.
We've evolved into kind of a chronic disease management program for a lot of our patients. We try to keep them from being on that revolving door to the emergency room and inpatient hospitalizations. So everybody else on that board is a volunteer.
Since 1977, the clinic has been operating through donations of time, money, and supplies, successfully caring for thousands of patients in dire need of comprehensive medical care.
It's like a well-choreographed dance. It truly is.
Jeannie Shapiro is the executive director at the clinic and shares the complex nature of caring for patients, along with organizing volunteer hours, donated supplies, and funding.
Knowledge is power. So if I feel we can introduce what they have, their medical problem in the most simplistic terms, then they're able to contribute and be a part of it.
We're a neighborhood. You know, we like to capture our citizens in our area here in North Pinellas County. Our goal is to keep them, as I said, out of the hospital, out of the emergency room, those expensive care locations. Try to keep them stable and as optimally functional that they can continue to work.
Patients do have some requirements to pay what they can.
They're asked to provide a donation, if possible, every time they come. And this is not for seeing the physician, because that is free, but it's to help offset our operating costs and the medications that we buy and provide them and other services and medical supplies.
Doctors, including specialists and surgeons from all over the Tampa Bay area, volunteer their time at the clinic. Student volunteers, including USF Health College of Nursing students, donate their time at the clinic, with opportunities for learning and engagement.
I've had doctors come in here and they'll come to me and they'll say, I don't know how this works. I don't know how you guys do this. I was here for 3 hours today and I saw more pathology today than I see in 3 years at my practice.
There are limitations to the extent of care the clinic can provide, and they also encounter cases that are too difficult to diagnose, which is where a medical academic center like USF Health could be a resource for research and discovery.
We do run into barriers, but we'll figure out a way to get around it. We work hard to accomplish that.
For USF Health, I'm Katie Hennig.